Hello and welcome back to the One Thing podcast. I'm Robin Bettenhausen and I'm here with my colleague,
Tom Kelly.
And we are so excited to welcome two new guests today. We have Lori Hubler and Lesley Brown Albright from Nonstop Health. Welcome, ladies. Thank you so much for joining us.
Thank you.
Yeah, thanks for having us.
I feel like every time I've spoken to you the last couple of months, you've been on a whirlwind sort of world tour, or at least US-based tour, at different conferences. So what was your favorite stop by far and why?
Oh my gosh. Well, Lori and I recently went to Sacramento, and we were at one of the SHRM conferences, and it was great because we got to connect with employers, we got to see broker partners there, just great engagement, really good group, and we just like being around our people, so it was really lots of fun. I don't know, Lori, I don't want to speak for you, but
No, I agree. And it was small. Sometimes we attend conferences that are just so huge and overbearing, and this one was a little bit small and I don't know, just felt more homey, I guess.
California is not a bad place to be.
No.
Well, I'm sure one of the things that you spoke about while at that conference and all of the others is a little bit about health equity. So I was hoping that we could start off by you telling us what is your definition of health equity and how does first dollar coverage from Nonstop Health really fit into that theme?
Yeah, sure. I'll go ahead and start us off. So, just kind of by definition, health equity is sort of the idea that everyone should have a fair and just chance to be as healthy as possible, regardless of factors like race, ethnicity, disability, sexual orientation, socioeconomic status. And first dollar coverage just means that a health insurance plan is going to pay first. At Nonstop Health Equity, it's really built into our mission. It's the core value of our company, I would say. All of our programs are built with first dollar coverage because, it's been proven that cost is a barrier to care for lower wage earning staff. The Kaiser Family Foundation has a ton of research on this. I would really strongly encourage anyone, that wants to dig into that to check out some of their articles. So we want to eliminate that barrier to care. That's why we're doing what we're doing. We're talking about people here. And, we believe that everyone should have access to high quality, affordable healthcare, whether you're signing someone in the door that day or you're running the organization. We found that our solution and first dollar coverage can provide a better way of serving the needs of healthcare consumers through their, employers, and that we could really make this a real right. And we can move the needle economically for employees and employers in a positive way. So I would say that first dollar coverage and health equity are sort of unwavering foundational building blocks for us here at Nonstop.
I know you just mentioned that, we're talking about people, and a lot of the clients that Robin and I work with are non-for-profits. And one of the ways that they attract people to come work with them is their benefits program. So
Yeah.
what is that employee experience with your program like, and what benefits do you see nonprofits see when they implement the program?
Yeah, I'll take that one, Leslie. So first of all, we see a lot of different things. So the first thing is morale, right? We see that one of the things within the organization is the morale just changes. I always think, imagine knowing that your employer truly values your health. They're removing the barrier that often keeps people from going to the doctor, right? Costs come down. We know that's the second largest spend really in most organizations. And so when the cost is beneficial to an employer and an employee, does a lot for that as well. And then retention and recruitment is huge within the organization. I'll just go back to, we have a group pretty close to you guys, Life Unlimited. They're not too far away. They're in Missouri. They have about 240 employees. The marketing team recently did a case study with them, and they shared that the success by improving benefits helped them increase their retention rate to over 60%. So huge win there when it comes to retention and recruitment. So that is really what we see. And then education, that's another thing that we hear a lot of within the organization, is just how strong our education team is. We are there to help ease that burden for them, educate them on the program. We want them to be able to know how to use the program really well.
Yeah, and just a quick follow-up question on that. What was it about first dollar coverage that drove the increase of 60% in retention?
Yeah, so I mean, what really drove that was the fact that they were trying to increase their total comp package. So, they're competing with large systems in the area. These are direct support providers, really tough work, very good work. And the employer and the CEO there is just phenomenal. I mean, just phenomenal. She has a whole structure where even her org chart has her at the bottom and the direct support providers at the top. So she really looks at it as serving the employees. And I think that the value, what I heard from the HR team as well, is just that people started to understand that, wow, this employer really values me. And, they had other people asking them, like, hey, can I come work for you guys? So they were actually getting inquiries to come work for them because the benefits were so rich. So it was a good point for us and a very proud moment for them when they sort of realized that they were really changing lives and the lives of people that were, taking care of our loved ones.
There's something so powerful in that story, right? And in the message of, you pay for this benefit, we want you to use it. And therefore, when you go, you're not going to have to make decisions about, do I fill this medication, or do I pay rent, or do I buy groceries that are getting even more expensive? And I just love that that's the message that we can bring to
Mhm.
people. And so, I've worked with you on several different clients, and they seem to really love it. I think one of the interesting things is when we do open enrollment meetings, sometimes we'll hear people say, this seems too good to be true. Or an employer might say, well, why isn't everyone doing this? So I'm sure you've heard those before as well. So how do you respond? Who's a good fit? Who might not be a good fit for a program like this?
Yeah.
Yeah,
I'll let you
such a good
start.
thing. I know, Lori, we just hear this so much. I'll take the first part, then, of course, I'm going to pass it over to Lori to speak to who is a good fit, because she's truly our expert. Um, it's too good to be true is one of our largest barriers that we actually face. People think we're selling them a unicorn to fix a really serious solution. It's the rising cost of health insurance premiums. I mean, everyone is, if you're an employer, you're talking about it, you're looking at this every year, you're faced with this in some regard. I think it can be really scary to trust something, new and maybe new to the market. We've been working well for a long time, but we are new to some markets. And they're going to try to trust something that's going to work within a damaged system. And I think the other thing is that change is hard. You know, it is a different way of looking at things. But I think that's why, we look to you guys, like, our broker partners, to really vet us and alongside the client and really discuss with us openly whether or not this is going to be a good fit for them. We at Nonstop, we're really looking for true partnership from broker to employer to employee all the way through. So that's kind of my job, really, is to build trust across the country. And Lori and I are out there having conversations all the time. But we respect that adaptation can be slow. But we aren't going anywhere, and we're just going to keep sharing our story and having our clients, our happy clients, share stories, because truly, they don't want to hear from us how great we are. They want to hear from our clients how great we are. So you know, it's a good thing. But Lori, do you want to talk a little bit about fit?
Yeah, of course. So, you're right, Robin. It's not a great fit for everybody. The first thing with Nonstop, to be able to offer our program, we have to have at least 50 employees enrolled on benefits. So that's the first place we start. But we want employers who value good benefits, right? Not everybody does. And so those kind of clients that really value offering good benefits with that first dollar coverage, those are a great fit. Any groups that are on high level plans that need to reduce costs without lowering a benefit, right? Because we're giving them that first dollar coverage, turning them into platinum plans. And then any groups out there that are a really good fit for any kind of alternative funding, but are concerned or unable to take on like the burden or the potential risk, because we eliminate that risk for them to take on our model. those are the real good fits for our product.
I know that there is a component to the program that has a Visa card. So could you explain kind of how that interacts with the program? And then also, how do you prevent someone from using it in the wrong place or maybe using it on something that's not approved?
Good question. So first of all, the cards come medically coded to only work for RX and medical, and we completely align it with the underlying carrier plan that we're wrapping. So very, very difficult for them to go and use it anywhere that's not supposed to be used. It just won't work. We also manage all swipes on that card in-house. We have a whole member services team, so we kind of pride ourselves on our member experience. We have a white glove substantiation process. We do not substantiate every single claim that is swiped on that card, but we can easily red flag things that may look a little suspicious or off, because really we're the fiduciaries on that employer's money, and we really just we take that seriously, and we want to be the best fiduciaries of that money and have a member experience that kind of mirrors that, right?
So we can't use it anywhere, unfortunately, is what you're saying. Right. That's by design.
Can't go out and buy airline tickets or anything like that with it.
Right. So we've talked over the last few minutes about how great this is for the member, right? Reducing their out-of-pocket, first dollar coverage, love all of that. But I think employers are also going to be wondering, is there a way that this hopefully reduces the long-term costs or our renewals, or what does it do for us in addition to how great it is for employees?
Yeah, I'm going to kick us off here. And I love this question because sometimes we do get that, like, is this just a 1-year solution? And the answer is absolutely not. We're looking to stabilize the employer's employee health insurance premiums. That's what we're trying to do. We're trying to stabilize things. And, I kind of said earlier that our clients tell our best story. And so I'm going to share just a small snippet of a case study. We have a large nonprofit, a community health center, in fact, with over 350 employees. They're a long-standing client of ours, been with us for about 9 years. They came on in 2015. And as of last year, we have saved the organization $7.5 million in health insurance premiums. And this is the key component, nearly $935,000 in out-of-pocket costs for their employees.
Wow.
Those are impactful numbers, and we are proud of those numbers, and we're excited that they've stayed with us as long as they have. And we plan on continuing that relationship. And, it's why we do what we do, really. But Lori, do you want to kind of expand a little more on like the intricacies of how that kind of works?
Yeah. So the whole idea behind our program is to be able to stabilize the increase to lower the percentage of renewals, right? And kind of how this happens is with the way we build out our program, most folks aren't even hitting the carrier plan. And so over time, less and less folks are actually even hitting the carrier plan, which in turn stabilizes that overall increase over time, right? I always use the funny looking mole as an example. If our whole goal again is to allow folks to be able to seek services and get things taken care of, a $60 copay might not be a burden for you and I to go in and get something looked at or taken care of, but it could be for a frontline staff member working at a nonprofit, right? If we can just eliminate that one, she goes in, she's able to get that taken care of, then maybe 6 months down the road, that person is not being treated for cancer. Mm-hmm. Those large claims, those cancer things, those catastrophic things, those are going to happen no matter what. And those are the things that affect the carrier plan, not the opting in to go get things taken care of. So with our mission, if we can just eliminate one of those, what we see over time is we see that really making an effect on those carrier increases.
Which everyone likes to see, right? I mean, we hate delivering bad news about increases, and we want employees to use the benefit plan. That's why it's there, and that's what they're paying for. So love all these examples that you shared. I think my last question for today is just, how do you see Nonstop Health changing the healthcare landscape? And you've shared some really good examples. Is there anything else that you want to leave our listeners with to understand why this program really matters, especially in the nonprofit space?
Yeah. Nonstop was created in 2012 with one mission, and that was to drive down the cost of health insurance for both employers and employees. And we know this is a really big statement, but we own it. We were born out of an agitation for the way lower wage earning staff were able to access care. Our CEO was, quite frankly, appalled. And in his eyes, he built this company to address health equity and humanity issues. And trust me, if you ever get the chance to meet David, there is no greater champion for people than David Sloves. It's pretty inspiring, actually. But so basically, he and our chief growth officer, Kristen Donahue, set out to build a workforce that is absolutely comfortable disrupting the health benefit status quo. We are proud of what we do. And I would say how it relates to nonprofits, when we're looking at the demographics of who makes up a typical nonprofit workforce, we're often talking about women and people of color. And let alone when you combine the two of those and you're talking about Black women in particular, the health disparity numbers are just absolutely staggering. And I would say for us as an organization, we feel like it's our mission to address these inequities. And the last thing we want is for someone who's working tirelessly to make this world a better place through a nonprofit organization to have to decide. And Robin, you already said it, to choose, like, am I going to put gas in my gas tank? Am I going to put food on the table? Or am I going to go to the doctor to get that mole checked out that Lori talked about? That choice is fundamentally wrong for people to have to make. So we're helping nonprofits with our solution by showing them that equitable benefits are possible without damaging the nonprofit or the employees financially. And we're helping them uphold their missions of community and caring for people. We just happen to be doing it through employee health benefits. Lori, do you want to expand on that a little bit?
I think you nailed it, Lesley. I think you pretty much said everything, but kind of one thing that I'll leave, it's more of a thought, and it came to mind when you were speaking, is I always just say that to nonprofits, they just to be open-minded, right? Because sometimes, again, we go back to that, this sounds too good to be true, I don't understand it, what is this? And just to be really open-minded that it's just a different way of purchasing healthcare to be able to give that health equity to your folks, right? I always say, why pay the carrier for a richer plan design for the just in case your members use it when you can internally pay yourself, right? Just because it's a less expensive healthcare plan, we're turning it around into a platinum plan. So
Yep.
that would be my final thought on that.
I can't think of two better guests for this year. Tom and I have really focused all of our communications that go out on a quarterly basis to be around health equity. So I was really looking forward to this conversation. I think there's no better time to chat about it. And I want to thank you for joining us on the One Thing podcast, and we'll talk again soon.
Thanks so much.
Thank you.